Difference between Hypospadias and Hydrocephalus. Look at this picture shows that detail. What is hydrocephalus? Hydrocephalus is a condition characterized by the abnormal accumulation of cerebral fluid (CSF) within the brain's ventricles, leading to increased intracranial pressure and potential brain damage. What is hypospadias? It is a congenital condition where the opening of the urethra is located on the underside of the penis instead of at the tip. Difference between one definition. Hydrocephalus, a condition where there is a abnormal accumulation of cerebrospinal fluid within the brain's ventricles. Hypospadias, a congenital condition where the opening of the urethra is located on the underside of the penis instead of at the tip. 2. Affected area. Hydrocephalus primarily affects the brain and its ventricular system. Hypospadias affects the genitalia, specifically the penis. 3 symptoms. Hydrocephalus symptoms include enlarged head, rapid increase in head circumferences in infants, vomiting, sleepiness, and downward deviation of eyes. Hypospadias symptoms include an abnormal location of urethral opening, curvature of the penis, and abnormal spraying of urine. Four causes. Hydrocephalus can be caused by obstruction of CSF flow, overproduction of CSF, or impaired absorption. Hypospadias often consider a congenital anomaly where the urethral opening does not fully develop at the tip of the penis during the fetal development. 5 incidents. Hydrocephalus occurred in approximately 1 in 1000 births. Hypospadias occurred approximately 1 in 200 to 300 male births. Six diagnosis. Hydrocephalus diagnosed through imaging studies such as ultrasound, CT scan, or MRI. Hypospadias diagnosed through physical examination of the genitalia. 7. Treatment. Hydrocephalus treatment often involves surgical placement of a shunt to drain excess CSF, endoscopy. Third, ventriculostomy. Hypospadias treatment involves surgical correction to reposition the urethral opening to the tip of the penis. Hypospadias repair. Eight long-term effects. Hydrocephalus without treatment. Hydrocephalus can lead to increased intracranial pressure, brain damage, and developmental delays. Hypospadias, if untreated, it can lead to problem with urination and sexual functions later in life. 9. Associated with other conditions. Hydrocephalus, often associated with neural tube defects or conditions like spina bifida. Hypospadias may be associated with other congenital anomalies affecting the genitourinary system. 10. Genetic factors. Hydrocephalus can be caused by genetic factors or occur sporadically. Hypospadias, there may be genetic component involved and it can also occur sporadically. 11. Surgical complexity. Hydrocephalus surgical procedures for shunt placement or ventriculostomy are typically complex neurosurgical interventions. Hypospadias surgical repair is generally less complex compared to neurosurgical procedures. For hydrocephalus, total age of diagnosis. Hydrocephalus often diagnosed in infancy or early childhood. Hypospadias diagnosed at birth or during early childhood. 13. Prognosis. Hydrocephalus prognosis depends on the underlying causes, timing of diagnosis and effectiveness of treatment. Hypospadias prognosis is generally good with surgical correction, but long-term outcome can vary. 14. Monitoring. Hydrocephalus require long-term monitoring to assess shunt function and complications. Hypospadias requires follow-up to monitor for any urinary or sexual function issues. 15. Research and advances. Hydrocephalus ongoing research focuses on improving shunt technology, relatively treatments and understanding genetic factors. Hypospadias research continues to improve surgical techniques and outcomes as well as understanding genetic and environmental influences. Thank you. Have a good day.